Hair loss can occur for many reasons. One of the major reasons is androgenic or male pattern baldness, and that happens because of a sensitivity of hair follicles to testosterone. And certainly that's the main cause of hair loss in men as they age, which causes a recession of the hairline at the front and a thinning on top. This can also affect women as they age, as their estrogen levels drop and comparatively their testosterone levels can rise. Some women natively have fairly high testosterone levels, and then also from exogenous hormones in the form of supplements or from contact with a man who's using testosterone cream, women can develop higher testosterone levels, which can lead to male pattern baldness as well. Apart from that, there is a normal just age-related atrophy of hair follicles, which affects women. Just like other parts of our body age, our skin gets thinner and drier. We also tend to lose hair on the top of our head. We also lose it out of our eyebrows, and this is due to a shrinkage of the hair follicles and a reduction in their ability to produce hair. So the hair follicles themselves shrink, there is less blood flow to the hair follicles, and then a lot of those follicles can go dormant. So when we use platelet-rich plasma, we're effectively improving the blood supply to the hair follicles. We're also turning the hair follicles back on again, or making them grow bigger, and kick-starting some of the dormant hair follicles to come back to life. Women will tend to lose hair more in a global way rather than in just an area as in male pattern baldness, but hair loss affects many women as they age. Obviously, after certain medical procedures such as chemotherapy and those things, there can be quite profound hair loss. Hair loss can also occur after major events in people's lives or major illnesses. A death or a major stressful event or a major illness can cause the hair follicles to synchronize, and then approximately 2 to 3 months after the event, you get a shedding or molting of the hair called telogen effluvium, which can be very distressing for many women. It happens after pregnancy as well. Platelet-rich plasma can once again be used to stimulate more blood flow to those hair follicles, more growth in them, and to keep the hairs in a hair follicle in an active growing state for a longer period, so the hair grows longer before it falls out. So it can be used to treat various forms of hair loss. The traditional treatments for hair loss, the major two treatments are Propecia or finasteride, which is a dihydrotestosterone blocking drug. So it blocks the conversion of testosterone to dihydrotestosterone. And dihydrotestosterone is a metabolite of testosterone that's about 5 times more potent than testosterone, and is the main toxic metabolite to the hair follicles. So finasteride blocks the conversion of testosterone to dihydrotestosterone and can save further hair loss from occurring. The other major drug that's used for hair loss is minoxidil. Minoxidil is a vasodilating drug, and it's applied directly to the scalp or sometimes needled into the scalp to dilate the blood vessels around the hair follicles to improve the blood flow and nutrition to the hair follicles. Another treatment option for hair loss is using low-level laser therapy. So using a red or infrared low-level laser on the scalp to stimulate more blood flow and to more mitochondrial activity in the cells in the hair follicles to stimulate them to grow further. These can all be used in combination with platelet-rich plasma. Platelet-rich plasma, or PRP, is blood that's been prepared in a way to extract the red blood cells and concentrate the platelets somewhere between about 2- and 5-fold. Platelets are little sticky cells in the blood that are involved in wound healing, and when the body is injured, the blood clots at that site and the platelets get stuck in the blood clot. And what we now know is that the platelets then release growth factors, and that these growth factors cause other stem cells to be attracted to the area, then differentiate into collagen producing cells, blood vessel producing cells, and skin producing cells, and then upregulate and start to heal the wound. So platelets are the cells that initiate and govern the wound healing process, and they're now used in many areas of medicine. Cosmetically or aesthetically, we can use them to rebuild and boost the skin by thickening up and improving the production of collagen and elastin fibers. With hair loss, it tends to be more of a long-term effect, because what we're relying on is that the platelet-rich plasma is going to stimulate the growth of new blood vessels, which are then going to nourish the follicle and enable it to grow stronger and longer. We're also hoping the PRP is going to turn dormant follicles back on again and start them growing, and to hold the hairs that are there in the follicle for a longer period of time. All of those processes are things that can take weeks to months to occur. So we're looking at a treatment protocol of stretching over approximately 6 to 12 months. So my treatment protocol for using PRP would be to have 3 initial treatments spaced somewhere around a month apart, and then a follow-up treatment at 6 months, and then at 12 months, and then assess how often after that we need to do follow-up treatments. So that would be our normal treatment protocol. But we're looking at seeing results develop, initial results in around 3 months, and full results in 6 to 12 months after treatments. The scalp's a very sensitive area, and there are many pain receptors there. And when we're injecting PRP, we want to inject it evenly over a large area. So it does involve multiple needle pricks. What we normally do in this situation is use an anesthetic block up in the nerves above the eyebrow. It's called a supraorbital block, and that will give numbness from above the eyebrow to the vertex of the scalp. Behind that, we can also use local anesthetic blocks for the back of the head as well, but that's usually not necessary because most of the hair loss is usually in the frontal compartments or at the crown, and they can be effectively blocked with anesthetic blocks. For anxious patients, we can also use nitrous oxide or laughing gas, which reduces the anxiety of the treatment and the anticipation of the pain, as well as reducing the pain itself. So it can be a very effective adjunct to local anesthetic blocks. There's very little aftercare. The scalp will be a little bit sore and bruised for a period of time. There's no real problem with washing the hair normally or anything like that afterwards. When we do use platelet-rich plasma on the scalp, we put nerve blocks in above the eyes to give numbness on the scalp, and they can result in a little swelling or bruising around the top of the eye the next day, but this is usually very minimal and will go within 24 to 48 hours. Following that, there's no real special care for the hairs at all.